is Grant Swallows, the Director of Schools in Warren County, and we're glad that you are joining us for a sit down with the director. This is the first one of these that we're doing in the new school year. The last one we did was with our outgoing director, Bobby Cox, and he was in the host role and I was being interviewed. And so I've now moved over in many ways into the other chair and to filling his role. And we are glad to have you today. We are on Zoom, as like most things in our country and our world. We've done some transition. We're doing some different things. And so we thought that it'd be great for sit down with the director that we do the same thing. And so first of all, I want to give you a little bit of update about what's going on in our school system. We are in September. We began our school year in the 1st of August, and we've had a lot of successes and we've had a lot of challenges that have been highlighted by our struggles and really the things that we've been able to do around COVID-19. Obviously, this is not a unique problem just to our school district. It's countrywide, statewide, countrywide, nationwide at this point. And so today, our focus for sit down with the director is going to be talking about the health side of things related to school reopening. Obviously, we began the year in what we've all called a hybrid method of school, to where students have been going 2 days in school and 3 days learning remotely. And we've seen a lot of good come from that. And we've seen some challenges that have come from that as well. And so I first want to say I appreciate everyone's patience as we've worked through this. This has been an extremely challenging time, extremely challenging for lots of different people, for teachers, for administrators, for cafeteria workers, for maintenance workers, for our school nurses, and for our students and our parents. This has all been different. We've been learning differently. We've been approaching school differently. And so I want to thank everyone for their patience, for their attitudes toward trying to make sure that we return to school in a safe environment. And because we know that children and students need to be in school. We've said that from the very beginning. We know that the school environment offers them so many different things, not whether it's first of all, it's education, but it's also social and emotional supports. It's warm meals. It's relationships with adults and teachers that are there for them and want the best for them. And so I'm glad to see what we've been able to do in Warren County as we've come back. A lot of the questions that I've gotten related around the school reopening has been based on, has anyone gotten sick or what are our numbers? We're going to talk about that in just a minute. I do want to say that another question that I've had has been based around school enrollments and how many students have come back to school. And we've been very, very pleased with how many students have come to school this year in Warren County. We're only about 40 or 50 students off from where we were last year at this time. I want to say that that's most likely a credit to us extending the opportunity for students to learn through the VIP or the virtual instruction program. And I also want to say it's also a tribute to our schools and our administrators and our teachers doing a fantastic job of making sure that we're putting the students first and caring for them and making sure that we're educating them as well. I'm excited today to welcome our guest. And this is Sonja Walker. She's a registered nurse. She's also the director of our health services program. And she's also been asked to wear a lot of hats during this time and do a lot of different things. But I'm going to just welcome her in. Sonja, we're glad to have you today. I know it's strange. We're actually not very far apart from each other, but we're on a Zoom call together. But that seems to be a sign of the times. And so first, I want to thank you for all that you've done. And I want to say publicly, I appreciate the fact that you're heading up a very capable and great group of nurses who have just come in a very strange time and done some fantastic work. And so I want that to be the first and foremost thing that we say, because they've been fantastic. And so I'll give you a chance if you want to say something about them. Now's the time to do it.
Well, thank you. Thank you. Thanks for asking me to be here. And I think the nurses that we have in Warren County, school nurses, are top notch, best nurses that we could possibly have. And they have worked diligently and hard, very hard, every day at keeping students and staff safe. So I'm proud to be a part of them.
Yeah. Well, thank you so much for the how you've done that and how you've led them. I got a chance to be with you all a couple weeks ago, and just the attitude that they had before we came back to school was, we know this is going to be tough, and but we're ready and we're excited to get back to be in school and serve our kids and serve our school. So tell us a little bit about you and your job in Warren County, how long you've been here.
I've been with the school system for 17 years, starting in August. So it's been a great job, good experience. I've been a nurse for 31 years. So I've done home health and background and hospital background as well. So it's the last 17 years, that's been my longest nursing experience and career with the school system. So it's again been a great job, I'll say.
You could probably add about I don't know, these last 8 weeks might add up to about 3 more years. So you may be at 20 years at this point with all the work that everyone's had to do. So
I've noticed more gray hair.
Yeah, right. Yeah, I think we all have at this point. But so let's talk about it. Let's talk about how it's going in our schools. Maybe share with us a little bit about our current numbers and maybe some successes that you've seen, and maybe even some challenges that you've seen.
Currently, we've got 20 students isolated, 89 quarantined. Staff-wise, we have no staff isolated, and 8 quarantined. Now, we've added since Monday, as of today, the last time I looked, we had added 7 students to that 20. So we're at 27 students isolated, and then we've added 18 more quarantined students.
So I don't want to interrupt you, but let's talk about isolation and quarantine. So define those for us a little bit so that everyone watching knows what we're talking about.
An isolated case is considered a positive case. That's a COVID positive person, someone who is isolated. A quarantined case is someone who is a close contact exposure to a COVID positive case. And those are quarantined and the days change on that.
And how do you become a close contact?
You would have to be within 6 foot for now 15 or more minutes.
And she says now because that began at 10 minutes and now has moved up to 15.
Yes, yes, right. It recently changed on September the 2nd. The CDC and Tennessee Department of Health revised that from 10 minutes to 15 now.
Yeah. So those numbers, talk to me a little bit about that. Has that been, we've been in school almost 6 weeks at this point. Has it been pretty standard with that number, or has it gone up and down or fluctuated?
It fluctuates some, but not much. That's pretty standard. The numbers, I think, they've not jumped tremendously. I think that's a huge one of our successes that you had asked about earlier. I think we've been able to safely reopen schools because we've been able to implement the guidelines that the Tennessee Department of Health, CDC, has put forth for us to for schools to safely reopen. So our numbers, I'm proud. I mean, I know I hate anyone that's that are sick, but I think our numbers have maintained well. We've done well with that.
Why do you think that is? But I mean, I just, maybe we have a conversation about that. I'll add my 2 cents, but what do you think is attributed to that?
I think hybrid has been a huge factor in our numbers staying low, because we're able to implement what they tell the CDC and Tennessee Department of Health tell us, social distancing is a huge factor. Um, and Staying that 6 foot apart is the biggest part when we're looking at a close contact. Um, that's the question. The number one question is, were you within 6 foot for 15 or more minutes? So that, and then that's mask or no mask. So that is a huge help to be able to say, no, I was not within 6 foot, because there's less people in the building. And therefore we don't have to quarantine as many people. What I see we're finding out people are exposed outside of school. We're seeing greater numbers exposed outside of school, and they're having to quarantine because of a contact at home or another location.
Or I guess that's one thing, and I don't know that anybody knows the answer to this question, but one question I get a lot is, how do you know where they got it? I mean, you're saying they're getting mostly outside of school. I assume that that's when we know, hey, the student knows I was around a positive person at church or in the community, and then they come back and tell us that. Am I right in assuming
Yes,
that?
yes, you are correct in that.
And
Yes.
then, but still, from the school standpoint, when we see that positive case, then we still have to go about the close contact tracing, because right, we have to 48 hours before they begin to show symptoms. Is that right?
Yes, that's exactly right.
Okay.
They are most contagious or as contagious 48 hours prior to the onset of symptoms. If they're asymptomatic, it's 48 hours from the day of the test.
Okay. Yeah. So let's talk about that a little bit. Tell us, we get we'll do a hypothetical. We get a positive student case, or even a positive staff case. What does a school, or what does our system do when we get that information?
Well, of course, we identify the positive case, and then we immediately begin questioning, when did your symptoms start? And then we go into seating charts, pulling seating charts from teachers, looking at who they were in front, if the positive, who was in front of them, to the side of them, to the back of them, anyone within 6 foot. We also call that positive person and ask them to identify close contacts. And again, then we go back to the seating charts based on that as well, and look at who we determine to be a close contact in the school setting. And then from that point, once we identify those close contacts, we make a phone call. The nurses pick up the phone and call that parent and talk to them and tell them that they've been identified as a close contact. We give them, a snapshot of, this is a 14-day, a non-household contact should quarantine for 14 days. Ultimately, though, the Tennessee Department of Health, they have state contact tracers that will begin calling a positive person, and they may call the close contacts as well. But once they're identified, they're notified, called, and then I think a courtesy call goes out to the other students who were not close contacts, but just to let them know that there has been a positive case within their class setting.
And that's great. I appreciate that. I've said this a couple of times. I think as a parent myself, and you're a parent yourself, I feel like that we're, as a school system, we don't necessarily have to do that courtesy call, but at the end of the day, I think if my child was in a classroom with a positive case, even though if we were close contact or not, it would be nice to at least know that. And so I appreciate the fact that you all are doing that. Talk to me a little bit about the contact tracing, and just maybe how's that going? Is it an easy thing for our nurses to do? Just maybe give us a little bit of insight into how that takes place.
Okay, yeah, contact tracing is it's time consuming. I will say that, and I want to say that we are doing that as a directive from the Tennessee Department of Health. Those contact tracing has to be done because that is in the guidance, and they're a close contact. Now, it does take time gathering phone numbers and parent names, making phone calls to parents that you might not necessarily get on the first call. and you could potentially, and we have had up to 15 close contact cases from a positive. So that you can imagine trying to notify 15 parents individually and talking to them and explaining the process. So it is time consuming. But again, it is something that has to be done, that we feel strongly about doing. Each individual parent reaching out to them and calling them and talking through the process with them, and then educating them and giving them instructions safely as to what they need to do
Yeah.
from that point forward.
Yeah. And so I want to say this just, I guess, because from the very beginning of this, I've talked about the fact that there are two things that we really want to focus on, and that's keeping kids safe and getting kids an education. And so we've gotten a lot of correspondence over the last little bit about parents and students are frustrated because they're having to learn remotely 3 days, and I get that, and I want everyone watching to know that we've said from the beginning that we want kids to be in school. That's why we do what we do. We want them to be in school 5 days, and that's always been the goal, is to try to get students back to the traditional learning environment for 5 days as quickly as we possibly could do that. But I also want to make the point, and the interviewer is not supposed to make the point, but I'm going to, that we would struggle when we come back 5 days to have all of our students in a small classroom environment, because it ultimately will make the determination, us determining close contacts, it's going to make that harder, and it's going to lead to more students having to be quarantined. From a health perspective, what are your concerns about everyone, us coming off the hybrid model and maybe putting everyone back in a classroom space?
Well, it's the social distancing. As long as the Tennessee Department of Health tells us if you're within 6 foot for 15 or more minutes, mask or no mask, you are considered a close contact and you will be directed to quarantine. Um, the more people you put into a small confined space, it's obvious that you're going to see your numbers and your cases increase. So, from a health perspective, I think the hybrid model allows us to stay healthier. And but when you put more people in a building and in a setting together, you just increase your chances of the spread.
So, with that being said, we know there are districts that have done that, and we've seen that they've had some success with that. So let's say we make that decision and we go back traditionally, which again I'll say is that's our goal. What can we do, or what can students do? What can teachers and staff do? What can families that are at home talking to their students? What can they do when sending their kids to school? And maybe there's less social distancing opportunities, but what else can they do to try to protect themselves?
Always maintain good hand hygiene. That's always been a number one. Wash your hands. Respiratory etiquette, covering your cough and sneezes. Use a tissue. Cough into your sleeve. Those have been around forever, and they work great. Just being aware of those around you, and try to limit the exposure as much as possible, and just being, I guess, conscientious about staying within your space, using your own things, and maybe not sharing as much as what we've used to in the past.
Yeah. Talk to us a little bit, Tanya, about the what families need to be aware of at home, maybe before sending their children to school. We've talked about this. We've tried to educate them, but if your child wakes up and has some symptoms, what do they need to do?
Thank you. Yes, and that's a big one too. Stay home if you're sick. If you wake up and your child has a fever, or if your child has symptoms that check a lot of the boxes on the COVID symptoms, which could be sore throat, dry cough, runny nose. We're seeing that, which a lot of with the allergy symptoms right now, it's hard to tell. But is it outside the normal for your child? Is it different than what your normal day looks like. If your child has allergies, is it the same for them this time every year, or is it different? Is it
Mm.
are they have more symptoms, worse symptoms? So we encourage everyone to stay home if they're sick, and then immediately that's what nurses are looking for. We have a black and white scripted sitting there for us algorithm from the Tennessee Department of Health again for those children who come in and complain with one symptom. They go home for 24 hours and go home and come back within 24 if they're well. They have two or more symptoms. They've been exposed to someone who is a COVID positive in the last 14 days. They may go home and it looks different for them. They may have to see a doctor. They may have to get tested. But again, encouraging parents, please keep them home if they're sick. Now is the time that we want kids in school, but we also want to limit the spread as much as possible. And by staying home when you're sick, that's a huge help as well.
Yeah, that's great. I appreciate that. Let's talk about one of the questions that I think I hear, or maybe one of the comments I hear a lot is, my child is being quarantined because of a close contact. Can I go get them tested and then send them back to school?
No, if they are quarantined because of being identified as a close contact, they are welcome to go get tested, especially if symptoms begin, but they cannot come back to school. They cannot go get a COVID test and be negative and come back to school. They have to do their 14 days.
Tell us why that is from a health
And
perspective.
that is Tennessee Department of Health tells us so, and it's also because what the CDC and Tennessee Department of Health have seen as far as health concerns, you could potentially develop symptoms within that 2 to 14 day period.
Right. Yeah. Good. Well, I would encourage anyone that's watching this that if you're listening, and Sonja is a wealth of knowledge, and she's got a group of folks that have so much knowledge. And if you have more questions, or if you've got something you don't understand that you're listening to us today, I would encourage you to call this office and talk to Sonja, and I'm sure she would be glad to help you. Call your school, talk to your nurse. They would be glad to help you through this. One of the things I don't want to lose sight of, because I know it's different. I know it's a strange time because of a national pandemic, but we've had school nurses for a long time. And so we've focused on COVID today, and rightfully so. But tell us what a school nurse, or tell us what your program does normally when they're not handling contact tracing or isolation and quarantine.
Well, we, of course, see students every day for procedures and medication administration, but we also look at immunizations and talk to parents about keeping those current and up to date. We look at health plans and identify disease processes and things that we would need to know about those students to keep them safe in school. We also do health screenings, which consist of vision and hearing, height, weight, blood pressure, scoliosis on the 6th grade to make sure their spine is growing normal and the way it should. So we stay busy doing a lot of other things, and we have been able to accomplish some of that this year as well on top of COVID. But normally, that's what we're focused on mostly, the health and safety of students and staff.
So one of the health recommendations would be from anybody is to get enough sleep. I don't think the nurses are following that recommendation at this point, are they?
Maybe not. No, probably not.
Yeah. So I guess as we wrap up here, is there anything that you would say, any advice that you would give to parents to help keep their kids safe or healthy, or anything you want to say to the public of Warren County?
I would just encourage everyone to maintain a positive attitude. I know these are difficult and trying times, and we're all working hard and diligent to do our best, keep the children safe. That's the number one goal, staff and students, keep them safe. So just, I think, maintaining positivity throughout your life, and teaching your children to be positive in the environment that they're coming into, it helps add security and safety to them, helps them feel safe. And we certainly, as nurses, try to stay positive, even in the worst times. But I do think it's, with that, we can maintain and get through this together and stay safe and healthy.
Yeah, I echo that, and again, want to thank you and your staff for the great work they're doing. And I just want to say to parents that maybe you get a phone call from a school nurse and they give you some news that your student's going to have to quarantine, and please know that that's not the nurse's call. First of all, it's not their decision. They're simply following the guidance that's been out there, and so I would hope that while I know that might be disappointing news, that we can treat each other with respect when we get that phone call, and just the thing that again, I having 3 kids in the school system, to know the comfort I feel knowing that there's a health professional in each one of our buildings that has the best interest of students at heart and can be there to take care of them if there's something wrong. It's great for us. And so I hope Warren County knows how fortunate we are to have you and your staff of very capable and caring nurses in our schools. And I just want to thank you for your time. Thanks for coming to sit down with the director. I know you probably had other things you need to do, and probably many more things that you would enjoy doing than being on here. But appreciate your knowledge and for you sharing that with us today.
You're welcome. Thank you for having me.
Absolutely. Folks, thanks for joining us on Sit Down with the Director. We're going to try to do these regularly so that we can try to get the good news of what's going on in our school system out, and not focus on the negative. Just like Sonja said today, we want the positive thing is, and that's the way I'll end. We've had a lot of challenges. We've asked students to wear masks for long periods of time. We've asked adults to wear masks for a long period of time, and that's not fun. We get that. That's one of the things that I hope can go away when all this hopefully goes away. But at the end of the day, everyone's had a great attitude. We've had very few problems with that. I appreciate that. And again, I'll just ask for patience as we make the best decisions we can. And the board did decide to keep the hybrid model through the fall break time period. But the board will be meeting soon to decide what we're going to do after fall break. And again, remember our 2 guiding principles. We want to educate kids and take care of them, but we also want to keep them safe, and we're required to do that. So I appreciate everyone and their attention. Thanks for watching us today. And we look forward to talking to you again very soon. Have a great day.